Good evening, Dr. Adel Janabi with you, member of the Royal College of Emergency Medicine, founder of Mrcem exam preparation website. I'm welcoming you here to our website. Thank you very much for visiting our website. And for candidates taking the exam, I would like to congratulate you for passing the primary exam, the intermediate exam, and reaching to the OSCE exam. So yes, this video is for you, candidates for the OSCE exam. Well done. You're almost there. One more step for you to become a full-fledged emergency specialist with a high standard guidelines, management approach, well-respected degree in your pocket, which enable you to practice emergency medicine anywhere you are, and it opens the door for you also to practice in the UK after gaining the GMC registration, and it will open a lot of doors for you for your future. So well done. I'm sure by now, if you look backward, when you started the primary exam, you see a different person. You see a different physician, for sure. You are more confident in yourself, in your performance. You are more knowledgeable. And most important, you are more safe doctor. So well done. I don't want to keep it long for you. I just want to give you a heads up about our OSCE program, which is dedicated to you guys and to help you to pass this final step from the first attempt. Wishing you all the best. So the OSCE exam is totally different style from what you experienced in your primary and intermediate exams. First of all, this is a stations-based exam. So this is more on like hands-on exam, and you have to be physically available for the exam. It's not an online exam. During COVID time, I think it was like 50-50, some online, some physical. Afterward, it came back again, totally physical, hands-on exam. Station-wise, it used to be 18 station. Now, at times, they make it 14 station. So you expect anything between 18 to 14 stations. Each station, 8 minutes. You have a 1 minute preparation before you enter the station. As you can see, it's a time squeezed exam. Again, you are testing under pressure and you have to be very well prepared, confident of yourself, confident of your performance, efficient in time management, so you will be able to handle these stations efficiently and you come up from the exam successful, hopefully from the first trial. So that's what we are targeting here. So when you join us, of course, you are free to join any course you want, or even without a course, you prepare your own way. It's fine. We have dedicated a free public group for our OSCE candidates on Telegram. You are welcome to join us. You can post your question or inquiry. We will try to help you as much as we can. And also for candidates who wish to join us, you are most welcome to join our private groups, similar to the primary and intermediate style, but this is a little bit different. We are having first PDFs channels, which has all the important knowledge and guidelines in the management of the stations. So you will find a huge collections of stations that can be possible to come in the exam. So it's like a high yield stations and how to handle them. And of course, it's divided into their topics. For example, you will find a group of multiple stations about history taking. History taking, we have different types as well, whether the history is regarding a painful situation or a painless situation or something in between, like something like not about pain or symptoms, is more on about an event which happened to the patient, like someone developed epilepsy, convulsion, or someone sudden dizziness, syncopal attack, loss of consciousness, hypoglycemia, you know what I mean. So these collections of these PDFs will prepare you and equip you with the needed knowledge how to handle these situations in regards of history taking. So you will get like a style or a guidance on how you can handle such situations And it's like you will be programmed. Once you see the situation is like this or the station is like this, okay, I will pull this style of tackling it and I will go 1, 2, 3 like this. So you will not miss any point, you will not skip any point, and you will make sure you are getting all the ticks from the examiner on that day. Then you will come to another PDF collection is about examination. So you will find general examination, like vascular examination, neurological examination, and you will find also isolated examination, which means cranial nerves examination, which is very important in the exam, joints examination, shoulder joint, very important, knee joint examination, hip joint examination, hands examination, very important. Some stations will come in the form of some situation, clinical situation, and then you will go into the examination. Then you will find another bunch of group also talking about clinical skills. It's like a procedures, for example, about central line, about arterial cannulation, and about ECG, about VBG, and about all these topics about clinical skills, how to suture, for example, how to give digital block, arm slings, very simple, but people ignoring it, and it can come as a station and you will waste your mark because you did not pay attention to it. So it's all about orienting you about the important stations and how to be prepared. Even if it's not that probable station, you are having enough knowledge and approach to handle it. So this is the main approach that we are providing to our candidates. Plus, after finishing this, you will find another PDFs talking about handling difficult situation. Like, for example, someone missed diagnosis and the relative came angry to you, or handling very challenging situation, like talking to a mother who just lost her child, or talking about breaking news about a big diagnosis and complication to a father about his child, or talking about organ donation, or handling someone who has do not resuscitate in their files, or the opposite. The relative of the patient is pushing you to do resuscitation, and you know that your consultant or your team decided that there is no point of doing this. Let the patient be comfortable, and that's it. So, these kind of tough, difficult, challenging situations, you need to be aware and well equipped on how to handle them. And you have to keep something in your mind, very important. This exam, yes, there is knowledge, of course. They will test your knowledge, of course. Your approach, yes. Your decision, yes. But the main thing also, big bulk goes on your attitude, your approach, the way you talk, the way you present yourself, the way you are confident with yourself, the way how you show empathy, how you show sympathy, your facial expression, and also how you are dealing with these situations. Your team leader skills, are you showing it or not? So you see, this is kind of different than what you experienced in the previous ones. Plus, you will find a bunch of PDFs talking about resuscitation, which is very important. Resuscitation is a staple scenario you will get in the exam, either whether it's ATLS, ALS, PLS, anything, even neonatal resuscitation you can get. So you have to be well prepared, and you will see a lot of scenarios in our PDFs talking about how to handle a resuscitation situation. Also, you will find teaching, because teaching is a very important component of you being an emergency specialist, talking and working with junior doctors, nurses, and medical students. So they have to test your skills in teaching. And most common scenarios in teachings is always either comes a scenario of someone having some toxicity and handling going on, or teach ABG, for example, or teach an ECG. Anything can come to you. So you have to know how to teach, what are the steps that you need to do, how to open the discussion in the station, and then how to end it within the time frame to grasp as much as you can from the marks. So you see, it's all about training your brain and your skills to be sharpened, well polished, well presented to the examiner during the exam day. And that's our responsibility to do it for you. You have the knowledge, we just give you the way how you can express your knowledge, how to present yourself during the exam. It's very important. Trust me, if you don't pay attention to these simple things, which we will discuss it in our private groups, you can lose precious marks. You will not believe how important they are until, God forbid, you test the sorrow of failing in the exam just because you did not pay attention to it, which we don't want that to happen to you. We want you, by God's grace, you will pass from the first attempt your exam and to make it a pleasant and pleasurable experience for you. And trust me, the Royal College of Emergency Medicine, they are very fair people. They are scientific, they are well-oriented, and they don't want to harm you or hurt you or being harsh on you. No, they just want you to be a proper emergency physician, and they want you to be a safe doctor. So one important component of your OSCE stations and to pass the OSCE is to be a safe doctor, no matter what scenario you are facing. First thing comes in your mind, am I safe doctor to the patient or not? Please don't forget this information. I want you always, always to pay attention to this. Then you will find a bunch of PDFs also talking about leadership. So, some situations, for example, whether how to deal with a colleague who comes to work with the smell of alcohol, for example, or someone always late for the duty, or someone, very harsh and not respectful to his colleagues. Things like that. Being in the senior level in the emergency, you should have the skills to handle these situations. And these can come to you in the exam. Or how to handle a disaster situation, how you can arrange and assemble the team. For example, a big road traffic accident or a train injury or whatever, any scenario, you get the idea. So you have to have the skills. And these things, you have to be aware. No one will tell you this unless you dig the information about them and well equipped yourself about them. And with us, rest assured, everything is covered from A to Z. At the end of the OSCE course with us, I promise you, you will see a different version of you. Not only for the exam, but even for your daily practice. You will see yourself become more confident, more oriented, more, I can say, like composite or compassionate with the patients also, showing more empathy and sympathy when it's needed, and being more as a leader for your team. You will love the teaching approach also. So it's very useful, very important for the exam and for our daily skills in our practice as well. So these are the PDFs. Plus, we provide with an online sessions on weekly basis, minimum 2 sessions, maybe more, depends on the time frame that we have, where we have a group discussion. In this group discussion, what we do first, initially, I explain to you the scenario and the station and how to handle it, how to approach it. Then you take notes about that. Then I will ask you as a group, one by one, to present it in a way like in the exam. So initially, we will use it without a timer to show you the difference when you are under pressure or not. Then we will put a timer and then we'll do it. And then slowly, slowly, you will pick up the pace. Trust me, in the beginning, you will find it is very difficult and challenging, but then you will see how you will develop the skills to master and complete the whole things needed in the station before even the bell will ring. And that's what we are looking for. That's what we want to be ready and well-oriented about it before the exam date. And this support will continue until before your exam date. And then also near the exam date, we will run mocks. Mocks means it's almost same concept of the mocks of the primary and intermediate, but this OSCE mocks are different. The mocks will be, we will run like stations, like an 18 station, for example. And these stations, we will go through it one by one, depends on how many students, candidates we have in the group, and then we will rotate them among them. Each one will have a chance to play the role in this scenario. Some of us will be candidates, some will be, for example, examiners, some will be actors, because in the exam, when you enter the room, you don't know what's inside. It can be just you and the examiner. Can be you and the examiner and an actor or actress, or it could be a mannequin or some equipments. It depends on the situation, which will we discuss each and everything about it. So don't worry, you can do it, but we have to have the right approach to handle it and to be able to do it. Okay. Now, if we talk about the scenarios, for example, that we might have, for example, in resuscitation, you might have a scenario coming of acute airway obstruction, like a choking scenario, a stridor scenario, or you might have a child with a brewy scenario. These are very important to know how to handle them. Or a scenario of someone with a devastating injury, road traffic accident or something, then the end you will reach to an organ donation discussion. And of course, in these stations, each station, when you read the notes in the 1 minute initially before you enter the room, you will find the scenario and then you will find what's needed from you. And there is a pie chart. This pie chart is very important to pay attention to it. Why? Because it shows you where is the bulk of the mark when you go inside to be tested. For example, if you see the bulk is history taking, so that means this station is more about history taking, or if you find about examination, or you find about decision making, or accordingly, you get the idea. So the pie with the distribution of the mark is very important to pay attention to it. So you might get a scenario of a chest pain, either in the form of an history taking or management, or breathlessness, or palpitation scenario. Can be a pregnant lady with palpitation or any palpitation scenario. So they ask you history taking, for example, and decision making, or disposition of the patient, or how to discuss the diagnosis to the patient, and etc. Or someone with a transient loss of consciousness, syncopal attack, whether it's an arrhythmia, hypoglycemia, or epileptic, very important. Also, you might have a cutaneous drug reactions, or someone comes to you with a rash, and then only from the history digging, you will find that the patient has inflammatory bowel disease. So you see how you link by taking a proper history. It's not about the rash at all. It's about you detecting that the patient has inflammatory bowel disease, and then about the management and etc. So you get the idea. Patient of urticaria or someone with fever. Fever, for example, someone with fever, you have to have a certain measures, certain phrases you have to say before once you enter to the room. So they will know this is a case which needs isolation, you need to have a proper PPEs and protections, etc. And if patient, for example, scenario needs an intimate examination, so you have to, I'm giving you an example. This scenario, for example, you have to emphasize on privacy, about not disclosing the patient information, about asking for a chaperone. Very important, whether you ask or the patient ask, because you have the right to ask as well. Even if the patient doesn't mind or doesn't want, you have to ask for a chaperone if you are examining, for example, if you are a male examining a female or a female examining a male. You get the idea. Very important, these points, once you mention them, you grab points. Very important, don't underestimate them. Hand washing, don't underestimate. You have to verbalize to the examiner to make sure he's aware of you, that this is your intention. You get the idea. So things that we will discuss and emphasize to make sure that you don't forget it in the exam. Scenario of osteoporosis, scenario of adrenal crisis, for example, Addisonian crisis, hypo and hyperglycemia scenario, heat stroke scenarios, hyperthermia scenarios, decompression sickness scenarios, radiation exposure scenario, for example, chemical injury. Anything like this, we can have a scenario about it and discuss it. And we have a huge collection of scenarios, don't worry. Someone about abdominal pain, renal colic, masses, constipation, diarrhea, jaundice, rectal pain, nausea and vomiting, dysphagia, pyloric stenosis cases, pediatric scenarios to differentiate between bronchiolitis, asthma, and bronchitis, for example, for adults, pneumothorax, difference between primary and secondary, and difference in their approaches. If you have influenza, for example, especially a mother bring a child to you asking for antibiotics, how you defend that this case need or this case doesn't need antibiotic, and how you convince the patient. And about the mental state, very important. Consent is very important, whether you're talking about underage with some scenarios or elderly with some scenarios as well. Dental abscess, for example, in pediatric, about negligence. Child abuse, very important topic, and we'll have a lot of scenarios talking about it. Depression, alcohol and substance abuse, very important to discuss it because it comes also frequently in the exam. Personality disorder, whether it's depression, whether it's mania, whether you're talking about schizophrenic patients, bipolar, anything, we have to talk about it, and we have the scenarios ready for that. Suicide attempt, sad person score, etc. Also, it's there. Coda equina syndrome, patient with acute back pain, limb pain, neck pain, joint pain, all these scenarios also we will discuss it. And we're talking about kidney injury as well, oliguria, headaches, acute confusion, whether it's elderly or someone hypoglycemic, and speech disturbances, gait abnormalities, visual abnormalities, and dizziness and vertigo is very important as well. Vaginal bleeding in females, pregnancy also has a special scenarios, stations, and special way to tackle them. Genital injury, whether it's assault or rape, or it's an abuse, vaginal discharge, foreign bodies, or patients in labor, sepsis patient, acute presentation is very important also. And etc. There are a long list of situations. You will find it in our PDFs. And then, as we said, we will have also an online session to apply all these, which we will record it also and post it in the group so that you will be able to come back and listen to it whenever you have time and taking notes of it and practice, practice, practice. My advice to you all, please practice with us if you are joining us, of course. But if you are not joining us, please practice with someone who can mentor you before even you practice with your colleague. Never ever practice with your colleague alone, because you don't know what you are practicing, whether it's correct or not, whether need correction or not, whether you need some polishing points or not. So it's very important to pay attention to this. Please, if you are joining us, you're most welcome. You don't have to worry about that. You practice with us, then among your colleagues, with us supervising you, and then we are correcting you accordingly until you reach perfection. And then you are ready for the exam. There will be guidelines also posted in our groups, all what you need, pictures and explanatory videos, etc. So wish you all the best. You are most welcome to join us, and see you soon in the courses. Thank you very much. Goodbye.